Axios reporter Maya Goldman joining us with more on this, with more on what's fueling this problem. Maya, thank you so much for joining us.
Thank you so much for having me. Great to be here.
So what is going on with the mental health workforce, and what are the main challenges that they're facing right now, and how does Biden's proposed insurance rules play into this?
Yes, so there are two separate but intertwined issues at play here. There's the mental health provider workforce shortage, and then the problem of inadequate insurance coverage for mental health care. So the Biden administration rules attempt to get at the insurance part of it, but advocates say that improving the financing of services, which is basically what health insurance is important to getting more providers into the pipeline. It can make it make being a mental health provider a more attractive job.
And what's going on with the insurance companies? Why are they denying mental health work?
So if you ask the insurance companies, they will, of course, say, they're doing everything within their bounds to adhere to these laws. But I guess to step back a little bit, the Biden administration rules that were proposed in July aim to improve coverage of mental health services under already existing mental health parity laws, which have been in place since 2008. And mental health parity just means that if you're an insurance plan and you cover regular medical, surgical health benefits, you need to cover mental health benefits at the same level. So if you get unlimited chronic disease visits to your doctor, you should also get unlimited visits for your depression or anxiety. And the Department of Labor has said that insurers are not adhering to those rules. So the Biden administration is basically just trying to beef up compliance with those.
Is it a situation where we have so many people that are seeking mental health help right now and just not enough providers? Is it just that simple?
That's a huge part of it. So about 160 million Americans live in an area without enough access to mental health providers. In Washington state, the National Alliance for Mental Illness estimates that there are about 2.8 million people that live in provider shortage areas. So it's a huge problem. And there are lots of reasons that there aren't enough mental health providers. But one of the big reasons is pay, and specifically low reimbursement from insurance providers. About half of mental health providers don't even take insurance coverage because they say that they get reimbursed at inadequate rates.
And so what needs to happen to boost the mental health workforce?
There are lots of options, lots of policy options. One could include getting rid of the cap on federally funded residency slots for psychiatrists. That is something that advocates have been calling for a long time. You can also increase coverage of marriage and family therapists and mental health counselors. The federal government has started to do that for Medicare. They've started to implement those coverage for those kinds of providers. You can also lean into peer support networks, which are people who have lived experiences who can help. A lot of these things require federal funding, which is hard to move around at this point. So it continues to be a problem.
So we're seeing a record number of teens and kids suffering from mental health problems as well. Do you think the Biden administration's proposal will be enough to help families get their kids the help that they need?
It remains to be seen for sure. I think that a lot of advocates are very optimistic that these rules will help increase insurance coverage, but the issue remains that there's this underlying provider shortage, and so it will be interesting to see if it trickles down to getting more people in the pipeline and specifically to helping kids and young adults.
Axios reporter Maya Goldman, thanks for joining us. We appreciate the insight.
Thank you so much.